Hello, my name is Chantel Rachel, and my presentation is on substance abuse in urban areas. Right here is the agenda. First, I'm going to go over definitions that will be used. SUD, which stands for substance use disorder in urban areas. Data, the theory that I chose, which is ecological systems theory, and initiatives. I'll begin discussing definitions of keywords you will hear throughout this presentation. Urban areas. Urban areas have a high population density. They are very developed, meaning there is a density of human structures such as houses, commercial buildings, roads, bridges, and railways. Urban area can refer to towns, cities, and suburbs. Substance use disorder, or SUD, is a complex condition in which there is uncontrolled use of a substance despite harmful consequences. People with SUD have an intense focus on using a certain substance or substances, such as alcohol, tobacco, or illicit drugs, to the point where the person's ability to function in day to day life becomes impaired. People keep using the substance even when they know it is causing or will cause problems. Drug overdose deaths includes deaths resulting from unintentional or intentional overdose of a drug, being given the wrong drug, taking a drug in error, or taking a drug inadvertently. Substance use disorder in urban areas. Urban areas often face unique challenges and factors that contribute to the prevalence of substance use disorders. Accessibility and availability of substances. Urban areas tend to have a higher density of establishments that sell substances, making them more easily accessible. This increased availability can contribute to higher rates of substance use and addiction. Stress and mental health issues. Urban living can be associated with higher levels of stress due to factors like overcrowding, noise pollution, and urbanization related challenges. Stressors combined with limited access to mental health resources can contribute to an increased risk of substance use as individuals may turn to substances as a coping mechanism. Data. The data used today is from the study Urban Rural Differences in Drug Overdose Death Rates. This study was found on the CDC website. Right here you have the age adjusted rates of drug overdose deaths by sex in urban and rural. So the overall the rate for drug overdose deaths was higher in urban counties than in rural counties. The rate of drug overdose deaths for males was 18% higher in urban counties than in rural counties. The rate of drug overdose deaths of females was 5% lower in our urban counties than in rural counties. In both urban and rural counties, rates for males and women males are about twice as high as rates for females. And this is a study regarding by race. So non-Hispanic American Indian or Alaska Native people had the higher rates of drug overdose deaths in urban and rural counties at 44.3% per 100,000. Non-Hispanic Asians people had the lowest rate in urban and rural counties at 4.6 and 4.5. Rates were higher in urban counties than in rural counties among non-Hispanic Black, Hispanics, and non-Hispanic whites. And right here is a look at the differences across the whole United States. Looking at this map, you can see that rates are higher in urban counties than in rural counties for more than 20 states. Here in Alabama, death rates were higher in urban areas. You have Tennessee, Louisiana, Kentucky, Michigan, Hawaii, and so on. There were 8 states where drug overdose death rates were higher in rural counties than in urban counties: California, New York, Connecticut, Virginia, and so on. Urban and rural rates were similar in 16 states, such as Arizona, Oregon, Utah, and Washington, and so on. The theory I chose for my topic is ecological systems theory. I chose it because it is useful when examining substance use in urban areas because it allows for a comprehensive study, a comprehensive understanding of the interconnected factors that contribute to substance use. Urban areas are complex environments with various social, economic, and environmental influences. The ecological perspective recognizes that individuals are not solely responsible for their substance use behaviors, but that larger systems, and contexts play a significant role. The ecological systems theory is a theoretical framework within the field of social work sciences that seeks to understand the complex interactions between individuals and their environments. It was developed by Yuri Bronfenbrenner, a renowned developmental psychologist. The theory identifies 5 levels of systems: microsystem, mesosystem, exosystem, macrosystem, and chronosystem. Microsystem, this refers to the immediate and direct settings in which individuals interact, such as family, school, and peer groups. It recognizes that relationships within these settings can have a profound impact on an individual's development. The urban environment can foster social connections and networks that promote substance use. Peer influence and social norms within these communities can play a significant role in initiating and perpetrating substance use behaviors. The mesosystem considers the interconnections between the various microsystems that individuals are part of. For example, the relationship between family and school, or family and community, and how these connections shape an individual's experiences. Exosystem includes settings that indirectly influence an individual, but in which they do not actively participate. This can include factors like workplace, community resources, and social services that impact an individual's well being. Macrosystem refers to the broader cultural, social, and economic context in which individuals are embedded. It encompasses societal values, beliefs, laws, and customs. Urban areas often have diverse populations with varying socioeconomic backgrounds. Socioeconomic disparities, inequality, and social determinants of health can contribute to the prevalence of substance use disorders. Factors such as unemployment, poverty, and lack of access to education and healthcare can increase the vulnerability of individuals to substance use. Chronosystem recognizes that temporal dimension of development and considers how changes over time in the individual and their environments can influence development. This may include historical events, life transitions, and individual experiences that occur at different points in time. Initiatives. So, right here are some initiatives that Alabama has taken in regards to substance use disorders. There's initiative called Recovery Housing Initiative, and this is done through the Alabama Department of Mental Health Housing for individuals with a substance use disorder began because of the opioid crisis. So they have a grant to work with housing where they're able to house those are experiencing substance use disorder to work towards treatment. And the other initiative is the State Opioid Response 2 and 3. It's federally funded grants aimed at reducing the opioid overdose and opioid death rates in Alabama. SOR2 and SOR3 cover the entire state of Alabama and include individuals with a stimulant use disorder. Treatments here and program. In urban area, treatment centers are significantly more accessible. This is because high density urban areas are more likely to have the funds, resources, and infrastructure to treat substance abuse as a public health issue, directing those with substance abuse problems to prevention and treatment programs and facilities. So here in Huntsville, there just to name a few, we have Magnolia Ranch Recovery, Bradford Health Services, the Salvation Army, BHG, which is Behavioral Health Group, Hisway, New Season, Huntsville Metro Treatment Center. Those are all places that work towards working with those that experience substance use disorder. Some have restrictions where it's male only, and some are male and female, or some are inpatient only, or some are outpatient and inpatient. It varies based on each treatment center. In summary, in addressing substance use disorder in urban areas requires a comprehensive approach, which is why we use the ecological theory and that the ecological systems theory, and that considers the multidimensional factors at play. And to address such in urban areas, as Walt Disney said, the way to get started is to quit talking and begin doing. So now we gotta begin doing. Thank you and have a good day.